Good evening. Good good evening from Niagara Falls, Canada. It's Sunday, September the 4th at 8:45 p.m. and we wanted to discuss sexual abuse, the long-term effects in Canada. I'm a dentist, James Frizzell, in Niagara Falls, Canada. I have a Bachelor's of Science degree in inorganic chemistry, and a dental degree. I have no formal training in psychiatry or psychology. And we're going to discuss this. And I've been told from the literature that when you have a trigger that comes from past traumatic events from sexual abuse, that trigger can strike so quickly that it's just like lightning. It happens so suddenly, so quickly, out of nowhere, just like lightning. And so what we're looking at here are some of the triggers that can trigger reactions. And some of these triggers are witnessing an event or situation that reminds you of the source of your trauma, seeing images that remind you of your traumatic experience, visiting places that remind you of your traumatic experience, hearing words or phrases that act on the trauma as trauma reminders. Those could be something you hear on the radio, on television. It could be the lyrics in a song that you hear. The words being heard from the lyrics from a song could be a trigger. Now, I looked up an article from the Canadian Medical Association, CMAJ. They have a journal, and the purpose of their journal article, and it was printed in June 2014, and this article states that Canadian data on the prevalence of child abuse, sexual abuse, and its relationship to mental health, the data is lacking. And so they did this article. They also made a statement that associations of some sexual abuse types and child abuse types have suicidal ideation and suicide attempts were stronger among women than men. And they stated, quote unquote, that our findings indicate that 32% of the adult population in Canada has experienced child abuse, defined as physical abuse, sexual abuse, and/or exposure to intimate partner violence, and that child abuse has robust associations with mental conditions. And their final conclusion, from the study was that from a public health standpoint, these findings highlight the urgent need to make prevention of child abuse a priority in Canada. Success in preventing child abuse and sexual abuse could lead to reductions in the prevalence of mental health issues in the future. And I was going to mention that this slide that's still on the screen, there are some other trigger events. For example, if a person were going to a medical doctor's office for an exam, they might feel lack of control, they might feel trapped. That might act as a trigger. Or likewise, visiting a dentist's office, having an appointment with either the dentist or the hygienist, feeling trapped, feeling lack of control, that could be a trigger. Now this here is a list. I'm reading this from the journal article. Long-term reactions. And these on the list include coping mechanisms, which may be beneficial and adaptive, or they might be counterproductive and maladaptive, resulting in self-harming substance abuse, eating disorders. So here's some of that list. These are the reactions that sometimes happen due to a trigger. continuing anxiety, poor health, a sense of helplessness, persistent fear, depression, mood swings, sleep disorders, flashbacks, dissociation, panic attacks, phobias, relationship difficulties that could involve relationship with a spouse or relationship in dating somebody. That could result in difficulties showing affection, being intimate, withdrawal/isolation. Those are some of the reactions felt by survivors. Paranoia and localized pain. This is a medical history dental form. And to give credit where credit is due, this form was designed and modified by Dr. Frank Stecky. He's a forensics dentist in Hamilton, Ontario, Canada. And I have adapted a similar amendments and modifications to my medical history form in my dental charts also here in Niagara Falls. And what Dr. Stecky did, it says here the medical history form. The 3 abuse questions are in blue, which are you would check off during the medical history. Child abuse, family domestic violence, spousal partner abuse, and then he supplemented that with 11 corollary potential abuse questions symbolized in the color red. And these are all spread out amongst the medical history questions. They're not all in one cluster. So he asked the question in red: drug abuse, head neck injuries, concussions, addictions, treatments, alcohol abuse, psychiatric care, anorexia, bulimia, jaw fractures, have you ever been assaulted, increased stress. So it's good to have a thorough medical history for a dental chart, and also that it might give the patient, he or she, a sense of compassion and empathy that the dental office addresses these issues, that we care. And in a dental office, no matter what the circumstance, there's a dentist, there's a hygienist, there's a dental assistant, and more often than not, patients will confide in the dental assistant, patients will confide in the hygienist. So with my co-workers, with my co-professional colleagues, the hygienist and the dental assistant, they seem to be more able to form a trusting relationship with dental patients. And in this case, dental patients that have a former history trauma from sexual abuse. And so it's just a matter of us showing compassion, empathy, doing whatever we can do to accommodate their fears, trying to avoid or accommodate anything that might trigger long-term reactions that they have to that trauma. And so these are just some of the things that dental offices are doing. At the moment in Ontario, the Ontario Dental Association and the Dentist Licensing Body are not addressing these issues full force, and they're not offering training for dentists in these areas of child abuse and sexual abuse. Not an adequate enough training. So thank you for your attention. I hope this has been helpful. And good evening from Niagara Falls, Canada. Have a good day. Have a good evening. God bless you.